Hey everyone, it's Anish. Undergoing spinal surgery is a big deal, and starting the road to recovery can feel like a challenge. One of the most important things we can do to bounce back is rehab through exercise. It's not about becoming a powerlifter overnight, trust me. We're talking about gentle movements that help you regain strength, flexibility, and get back to doing the things you love. Remember, everyone's recovery journey is unique. What works for one person might not work for another, and that's totally okay. Before you jump into any exercises, especially after surgery, it's super important to have a chat with your doctor or physical therapist. They're the pros and can create a plan that's tailored just for you. Think of them as your coaches for getting back in the game. In this video, we'll walk through 5 simple yet effective exercises that can help you regain strength and mobility after your spinal surgery. Let's get started. Alright, let's talk about walking. I know it sounds simple, maybe even a little too easy, but trust me, it's one of the best things you can do after spinal surgery. Think of it as hitting the reset button for your body. Walking gets your blood flowing, which brings oxygen and nutrients to your healing spine. It also gently works your muscles, preventing stiffness and helping you regain that range of motion you might feel you've lost. Now, I'm not saying to go run a marathon on day 1. Start slow and gradually increase your distance and pace as you feel stronger. Listen to your body. If you're feeling any pain, stop and rest. A good rule of thumb is to start with short walks, maybe 5 to 10 minutes, and gradually increase the time by a few minutes every day or 2. Remember, consistency is key here. Think of it like brushing your teeth. You wouldn't just brush once a week, right? Aim for a few short walks each day, even if it's just around the house at first. As you progress, you can start exploring your neighborhood or a local park. The key is to find a pace and distance that challenge you slightly without pushing you into the pain zone. And hey, walking is a great excuse to enjoy some fresh air and sunshine. Let's talk about your core, those deep muscles that support your spine. Think of them as your body's natural back brace. After surgery, strengthening your core is like giving your spine its very own team of bodyguards. One exercise that's super effective is the pelvic tilt. It's gentle, it's controlled, and it works wonders for building core strength. Here's how you do it. Lie on your back with your knees bent and feet flat on the floor. Imagine your lower back is gently pressing into the mat. Now, tighten your abdominal muscles. Think about pulling your belly button in towards your spine. As you do this, you'll feel your pelvis tilt upwards slightly. Hold for a few seconds, then gently release. That's it. It's a small movement, but you should feel it working those deep core muscles. Start with a few repetitions, maybe 5 to 10, and gradually increase as you feel stronger. Remember to breathe deeply throughout the exercise. Inhale as you tilt your pelvis up. Exhale as you lower back down. Pelvic tilts are amazing for improving core stability, which is crucial for supporting your spine, especially after surgery. A strong core means less strain on your back, better posture, and less risk of future injuries. We're moving on to bridging, an exercise that targets your glutes and hamstrings, those powerhouse muscles that play a crucial role in supporting your lower back. When these muscles are strong, they take the pressure off your spine, which is especially important after surgery. Let's break it down. Lie on your back with your knees bent and feet flat on the floor, just like you did for the pelvic tilts. Now, engage your core. Remember those deep abdominal muscles and gently lift your hips off the floor. You should feel your glutes and hamstrings working. Hold for a few seconds at the top, then slowly lower your hips back down. Focus on smooth, controlled movements throughout the exercise. Start with a few repetitions, maybe 5 to 8, and gradually increase as you feel your strength building up. Remember to listen to your body and stop if you feel any pain. Bridging not only strengthens your glutes and hamstrings, but it also improves hip mobility, which is essential for everyday activities like walking, climbing stairs, and even just getting up from a chair. Let's talk about stretching. Stretching is like giving your muscles a big sigh of relief, and it's especially beneficial after spinal surgery to alleviate any tightness or discomfort. One of my favourite stretches for the lower back is the knee to chest stretch. It's gentle, effective, and feels amazing. Here's how to do it. Lie on your back with your knees bent and feet flat on the floor. Gently draw one knee towards your chest, using your hands to support your leg. Hold the stretch for 20 to 30 seconds, feeling a gentle pull in your lower back. Release slowly and repeat on the other side. You can also do this stretch with both knees at the same time. Just make sure you're not forcing your knees closer to your chest. The goal is to feel a comfortable stretch, not pain. This stretch is fantastic for releasing tension in the lower back muscles, which can get pretty tight after surgery. It also helps improve flexibility in your spine, which is essential for overall mobility. Let's talk about core strength again. I know, we've already covered it, but it's that important. A strong core is like a force field for your spine, protecting it from injury and improving your overall stability. Now, when you think of core exercises, you might picture crunches or sit-ups, but those can put a lot of strain on your back, especially after surgery. That's why we're going to focus on a modified plank. It's a safe and effective way to engage your core muscles without putting too much stress on your spine. Here's how to do it. Instead of a traditional plank position, we're going to modify it by propping yourself up on your forearms instead of your hands. Make sure your elbows are directly below your shoulders and your body forms a straight line from head to heels. Engage your core. Remember, pull your belly button in towards your spine and hold the position for 10 to 30 seconds. As you get stronger, you can gradually increase the hold time. The modified plank is a fantastic exercise for strengthening your entire core, including your abdominal muscles, back muscles, and even your glutes. A strong core means better posture, less back pain, and improved balance. And there you have it, 5 simple yet effective exercises that can make a world of difference in your recovery after spinal surgery. Remember, consistency is key. Just like you wouldn't brush your teeth just once and expect a dazzling smile, you need to make these exercises a regular part of your routine to reap the full benefits. Before you jump into any exercise program, it's super important to have a chat with your healthcare provider or physical therapist. They'll be able to assess your individual needs and guide you on the best course of action for your recovery journey. They're your cheerleaders, your coaches, and your partners in getting you back to doing the things you love. Recovering from spinal surgery takes time and effort, but trust me, it's worth it. By staying active, listening to your body, and following your healthcare provider's guidance, you'll be well on your way to a stronger, healthier you.